Hey, thanks for making it back to Veterans Info Tap. If you watched this morning's video, thank you so much. If not, go check it out. Anyway, wanted to jump in on an article that came out earlier this month, and I kind of just skipped over it and didn't really want to share it. Didn't really think too much about it until now. So this morning's video, which was about the Senate's Committee on Veterans Affairs and the testimony that was provided by the Secretary of the VA with regard to the review of the fiscal year 2024 budget and 2025 advanced appropriations request. In reading that one this morning and going through that, it actually made me remember this one, this article that came out, or news release that came out earlier this month. And really it's about the VA's service from the VHA perspective. So remember, when you think of the VA and you say VA, you need to know what silo you're talking about. Is it VHA, Veterans Healthcare Administration? Is it the VBA, the Veterans Benefits Administration? Or is it the National Cemeteries, right? So where are we talking when we talk about VA? Usually it's in one of those silos. So this one is regarding the care that is received or that we're able to receive from the VHA, from the healthcare side. Now, I'll throw this caveat in there before I start this. I'm pretty sure it's geographical, meaning that, in some areas, VHA is going to be better than in other areas, just simply by the staff, right? So depending on where the staff is, will kind of depend on and the leadership will depend on what kind of care you're getting and that type of stuff. So with that, let's jump into it. Hit the thumbs up for me, subscribe, please, if you haven't. What happens when you do hit that thumbs up, it helps put this information into the hands of those of us that have not seen it or need it. So it's really a way to help spread the word. So anyway, let's jump into it. So the headline here on this news release is studies show VA healthcare is better than or equal to non-VA healthcare. So, I don't really know, right? I mean, I only know where I've been and the places I've gone. I personally have gotten fine care. I've never had any issues at the place, but I've heard horror stories in other places. So, I think that it's just kind of a geographical thing, to be honest with you. So I don't really know, but I'm curious to see what they have to say about it and what kind of studies they're talking about. So let's jump into it. The Journal of General Internal Medicine and the Journal of the American College of Surgeons published articles based on a systemic review of studies about VA healthcare, concluding VA care is consistently as good as or better than non-VA healthcare. That's pretty strong. Okay, let's move on. I mean, I don't like going to doctors, and it doesn't matter who it is, to be honest. I mean, I go if I have to, right? But if I don't need to go, I kind of don't. So. All right, moving on. The findings come from a national review of peer-reviewed studies that evaluated VA on quality, safety, access, patient experience, and comparative cost/efficiency. Of the 26 studies that looked at non-surgical care, 15 reported VA care was better than non-VA care, and 7 reported equal or mixed clinical quality outcomes. Of the 13 studies that looked at quality and safety in surgical care, 11 reported VA surgical care is comparable or better than non-VA care. Okay. VA is currently delivering more care to more veterans than ever before in the nation's history. Among the veterans who received their care from VA, approximately 90% trust VA to deliver their care. Well, come on. That's among the veterans who received their care from the VA, approximately 90% trust the VA to deliver their... No kidding, right? If I'm going to the VA, I'm going to trust. So the VA maybe did a survey. Do you trust the VA to deliver your care? Yes. Okay, well, 90% of you said yes. Well, of course you're going to say yes. I don't know why the 10% didn't say yes. If I'm going there for care, maybe they don't go to the VA, the other 10%. Anyway, sometimes I get a little tweaked out with surveys, right? Or percentages or data, because it's all in the wording and how you kind of phrase things and how you kind of set it up. So anyway, I'm not sure about that one. Moving on. These studies demonstrate that VA care is consistently as good or better than non-VA care, both in surgical and non-surgical settings, said the VA secretary. VA's public servants are here for veterans anytime, any place, even in the midst of a pandemic. Our goal at VA is to deliver world-class care to every veteran, every time, and we will never settle for anything less. This year's systematic review included studies published between 2015 and 2021. This is the third systemic review of studies comparing VA care to non-VA care, the most recent of which was published in 2017. Each of these systemic reviews has come to the same overarching conclusion. On average, VA care is better than or comparable to non-VA care in the domains of clinical quality and safety. This review was conducted by researchers at the VA Greater Los Angeles Healthcare System in California and the University of California, Los Angeles. You can read the full articles at the Journal of General Internal Medicine and the Journal of the American College of Surgeons. And then that concludes it. So, for what it's worth, I mean, look, whether it's better or not, okay. If it's the same, awesome. And I'll throw this out there as far as care is concerned. and this is just me and my own kind of way of thinking. I like to save money where I can. And one of the ways that I was able to do that, now every employer is different. My employer, so I'll tell you how my employer does it. If I select the lowest level of healthcare from my employer, it actually creates a kind of a refund opportunity from my employer. My employer then kicks me back the difference. And on average, it changes every year, but on average, it was about $500 or $600 a month that I would get back on my paycheck. So I didn't really care what kind of insurance I had because I was using the VA, so I just chose the lowest level. Now, there's also, and I've had employers like this in the past, I'm not currently with one of them, but I know people who are, where if you select, hey, look, I want no insurance from you at all, well, that's a cost savings for the employer if the employer provides that healthcare coverage for you. And in that case, they'll pass that savings back to you. So let's just say that the employer is willing to pay $1,000 a month for healthcare insurance for you, and you decline it. They take that $1,000 and they just give it to you. So if you are in the boat of going, hey, look, I really don't need it, have that conversation with your employer to see if there's some benefit if you select a certain insurance type or decline it altogether, if you can get more money on your check, especially if you're never going to use it because you're using VA, right? Or if that's going to be a deciding factor for you, it's better to be able to work that information than not. So with that, we'll go ahead and cut it there. Thanks so much for watching. I appreciate you. Have a great one. And remember, if we don't take care of each other, something went wrong.